Hello, everyone. This is Shalana Welch, and today I am going to discuss with you crisis management. We've been presented with two patients to discuss and to determine what our treatment of those patients will be. So, with patient number one, we have a 45-year-old male who's going through a divorce, found out his wife was cheating on him for about 2 years. She left without telling him, left a note, took the kids. They're currently going through the divorce. He reports that he feels stupid, doesn't know why he bothered trying to improve himself, unsure how he can go on. He reports he's having time difficulty on his job. The job made him take time off due to him calling in repeatedly. He's at risk of losing his job, is not motivated to go. He feels that he hasn't talked to his kids for a month. He feels that he's losing his kids, that they'll be taken away from him. When asked, he does report and admit to being suicidal since the wife left. That has resulted in him drinking at least a 6-pack of alcohol, we assume beer, each night. He also admits to having plans to shoot himself and that the only deterrent is that he fears losing his kids. But at the same time, he's losing hope that he'll ever see or talk to him again. So his probable diagnosis would be adjustment disorder with depressed mood. He meets the criteria. He's displaying a low mood. He has feelings of hopelessness. There are both emotional and behavioral symptoms. With adjustment disorder, there is a known stressor for him that would be a number of things: the wife cheating, the wife leaving, the wife taking the kids, him not having access to communicate with his kids, and also the pending divorce. The onset for a diagnosis of adjustment disorder um, is usually within 3 months. Onset of the symptoms within 3 months, and then so with an acute stressor, the onset can be immediate. Another diagnostic criteria requirement is that the feelings are out of proportion to what the patient is thinking. And for him, it's out of proportion for him to think that he will never be able to see or talk to his kids again. Um, that could be proven to not be true, just dependent upon the finalization of the divorce, and then the judge determining um, visitation with the kids, custody issues, and so forth. So for him to think that he'll never see them again, that's out of proportion to reality. Another diagnostic criteria is any type of impairment in social or occupational functioning. For this patient, he's missing work, he's calling out, he's at risk of losing his job to the point where the job forced him to take time off. For him, my main concern would be the increased risk of suicide attempts and completions associated with adjustment disorders with depressed moods. My treatment for him would be inpatient hospitalization of a voluntary nature. Here in Georgia, a 1013 would be signed. He would be held until placement at an ERF, which is an emergency receiving facility, was arranged, and then a peace officer would be assigned to transport him to the inpatient facility. And again, that is due to the increased risk of suicide attempts and completions, his level of depression, discord, his feelings of harming himself, and he also has a plan. Now, whether or not he has access to any firearms, that would not be known without further investigation, further assessment. But as it stands, he has an active plan, and the plan could be lethal. So we'll move on to patient number 2. In this scenario, we're presented with a 19-year-old female. She's married with a 2-month-old baby. She brings the husband in. She's been dressing provocatively, the clothes, the makeup. She immediately starts discussing a video on aliens, which she's been watching. She's displaying rapid, loud, and tangential speech. Looseness of associations are present between the video related to the baby. She's rambling. She shares that she believes the baby is an alien. She needs to take it to the desert and then leave it on the mountains for the aliens to retrieve. She's making plans to go camping with the baby and her husband this weekend. When asked about suicidal and homicidal ideation, she denies both. The husband reports the strange behaviors have been going on for a couple of weeks. He's never seen her like this before, and then he expresses a fear of leaving her alone with the baby. She further states that she knows the secret to world peace and that giving the baby back to the aliens will accomplish the restoration of world peace. So, with this patient, her diagnosis would be bipolar 1 disorder with peripartum onset. She's having a manic episode, which is being followed by a hypomanic episode. The onset for diagnosis, it's either within pregnancy or 4 weeks or within 4 weeks after delivery. For manic episodes, APA lists diagnostic criteria as the presence of at least 3: inflated self-esteem, excessive talking, flight of ideas, being easily distracted, elevated and expansive moods, and then goal-directed behaviors such as planning trips. For criteria, the symptoms would have to be present for at least 1 week. With this diagnosis, usually the patients do not believe they are ill or that they need any help. They display changes in dress, makeup, appearance. They dress more sexy, more provocatively. They become more flamboyant. The hypomanic episode, according to APA, the diagnostic criteria are pretty much the same as for the manic episode. However, the change in mood and functioning are observed by others, and then there are no impairments in social or occupational functioning. That means that the symptoms are not severe enough to cause problems in those areas. So, taking a look at her situation, it's almost textbook. The inflated self-esteem, the changes in her dress, makeup, and appearance, all of those were reported and are evident by the makeup, the dressing more the wearing of the heavier makeup, and then the provocative dressing. She's more talkative. That's evident by her rambling and rapid, loud, and tangential speech. Flight of ideas, same. She's making looseness of associations between the video series and then her baby. The goal directed requirement is her planning trips to go to the desert with her husband and the baby. And she also goes on to say she believes that she needs to take the baby to the desert and leave it on the mountain for the aliens to come and retrieve it. The symptoms have been present for more than 1 week, being that the baby is 2 months old as of right now. And then as far as the hypomanic evidence, the same thing applies, except that the husband has begun to notice the changes in her mood and in her behaviors, and even though they are present, they are not severe enough to cause any impairments in her functioning. She's still able to be a mother, and there were no reports that that has been compromised at all. So treatment for this patient would be the same. She would be admitted for involuntary hospitalization. Here in Georgia, that would be also a 1013 being signed. She would be held. Transport would be arranged with a peace officer, and then she would be taken to an emergency receiving facility or further evaluation. The reason for that being number one is that with the diagnosis of bipolar disorder with peripartum onset, there is an extremely risk of infanticide related to the postpartum psychotic episodes, and also delusions that the infant may be possessed, which is her case. She believes that the baby is needed by the aliens to restore a world peace. She feels that that baby needs to be taken to the mountains and left for the aliens to come and retrieve. All of those thoughts and statements place the infant at risk that she may be possibly planning a trip to the mountains for that reason only, so that the baby can be left, which is a risk of harm for the baby. And it can also be implied that she may be thinking of ways she can harm the baby herself and then leaving it for the aliens to come and retrieve. So that is my conclusion on treatment of those two patients in those scenarios. In summary, considering the risk of self-harm and also possible harm to others, they both would be involuntarily committed for hospitalization. Thank you for watching.